More and more, as time goes on here at our service, we've noticed that we're getting a group of young people that are coming to us who are feeling as though their food and eating is getting a bit out of control. And it's not just with their food and eating, it seems to be their emotions in general. That they come and they say to us that they feel as though their emotions are a little bit all over the place, and that they're struggling to think about how to manage that in a helpful way. To try and help that group of young people, we've developed a specific kind of multi-family therapy where we work with those young people and their parents, or families as a whole, and we try to think about how can we manage those strong feelings in the moment when they're really difficult. Typically, the kind of young people that I'm talking about are people whose food and eating feels a little bit all over the place. So perhaps in the day they might have periods where they're trying to eat very little, and then later they might have times when they lose control of their eating and they might binge eat. And typically what happens after that is there might be other unhelpful behaviours that come along with that. So things like vomiting, maybe using laxatives, excessive exercise, and perhaps sometimes self-harm as well. In the group, what we do is we work together with the young people and the parents together. It goes for about 3-4 months, and we meet every week. And we're really focused on two main things. The first thing is we want to make sure that young people and their families have the skills to manage in those times when things feel a little bit out of control. So what do you do in those moments? What do you do afterwards? And what might you do to maybe not, I guess, just to prepare yourself for those times that you know will be more difficult than others? So that's one thing, the skills. The other thing that we focus on is we want to make sure that families are communicating and supporting in ways that feel helpful. It's really, really common for these young people when they come to us that they talk about feeling really isolated, criticised, perhaps rejected, and definitely misunderstood. And it's tricky in those times, so we want to make sure that we focus a lot on how do we help people have conversations where they can actually understand what's happening for each other so that they can be helpful in the future.